Hi everyone, my name is Ogbolu Melvin Omone. I'm here to present to you one of my papers I've been working on HPV and cervical cancer in women, titled Effective Prevention of High-Risk Cervical Cancer Among Women in Developing Countries. Our case study today is Nigeria. What is the outline for this presentation? We have the background and motivation, materials and method, a statistical analysis, result, discussion, and summary. What is cervical cancer? Now, cervical cancer is a disease that is paramount among women. It is a kind of cancer of the cervix, the reproductive system in women. So what are the risk factors considered in this paper? We have human papilloma virus and cervical cancer, first coitus or early age at first sexual intercourse, number of sex partners, and at low risk here, we have poor diet, inadequate knowledge about HPV, and formation of cervical cancer. Materials and method. We have this assessment test developed by me. That's the Human Papilloma Assessment Test, which we call ART, and the study design. So we have 2,000 respondents on this assessment. We distributed to women during the conference, and we had 2,000 respondents who answered the assessment. Our study question here, we want to see how the socio-demographic factor affects them, age at first sexual intercourse, sexual behavior and sexual hygiene practices, records or history of STIs, which is very important, dietary behavior or habits, knowledge about HPV and CC. Also, we were able to use 1,677 women among the 2,000 women which filled the survey. So only 1,677 women were able to meet the inclusion criteria. That's Nigerian women living in Nigeria, women who have had sexual intercourse in their lifetime. We are not talking about those that have never had sex. Women between the age of 12 to 65 years. Exclusion criteria: women who are not Nigerians were excluded, women who have never had sexual intercourse, women below the age of 12 and above the age of 65 years. As statistical analysis, we used IBM statistical software tool, that's SPSS version 27.0 for statistical analysis, which involve descriptive statistics for the socio-demographic factor, the checking the CC and related risk factors, association between number of sex partners and CC, knowledge of level of knowledge, attitude, and perception of Nigerian women towards HPV and CC. So using product moment correlation coefficient, we were able to find association between the age at first sex and the population score. Our result for the social demographic factor, our result says we had 9.3% of the women to be between the age of 12 and 25 years. 80.6% of the women were between the age of 26 to 40 years, and 10.1% of the women were between the age of 41 to 64 years. Civil status, that's marital status. For the single women, we had 25.9%, married women 72.5%, divorced women 1.6%. So you can see the rate of divorce in Nigeria is really low. You could say that based on this result. Level of education. We can see that only 0.1 had no formal education. So most of these women are educated, yes. 0.2 attended primary school. 8.3 attended secondary school, 72.0 had a bachelor degree. You can see there is a high rate of education among these women. Because to have a bachelor degree is okay to be enlightened about some certain things in life. 17.6 had a master's degree, 1.8 had a doctorate degree. The level of income, 38.6 earned below 100 USD, $100 per month. That's a high rate of poverty among 632 people, 632 women. 27.3 earned between 100 to 200, which is minimally okay, but not so good. Why 18% earned between 200 to 500. 9.3% only earned 500, between 500 to 1,000. Why a minimal amount earned 6, and a minimal amount, that is 6.8 people, participants or women, earned above 1,000 years. You can see the high rate of poverty among those women. Now tell me, how would they be able to cater for their medical needs when in Nigeria there are no free medical services or facilities? So for the residing settlement, we had 39.1 to be in rural settlement, 60.9 in urban settlement. Now we're checking the formation of CC with age at first coitus, that's age of the first time they ever had sex in their lifetime. First, their poor diet, number of partners, and HPV history. We realized that only 7.0 who experienced their first coitus were between the age of 10 to 15. So we can say that based on first coitus, we could say that if just only 115 would be at risk of such circumstance of contracting HPV at an early stage, which is okay, but 115 women are highly at risk out of 1,677 women. Concerning diet, only 32.5% agreed that they practice a healthy diet, while many of them, 67.5%, said they experience poor diet, which do not include fresh vegetable, nuts. Of course, nuts are expensive. How would they afford nuts when many of them earn below 100 to 300 USD per month? They cannot feed well. Number of sex partners, we saw, according to a result, we are seeing here that 34.1 had between 5 to 20 number of sex partners. That is that is too much. So this set of people, 560, are at high risk of cervical cancer, because the more you have sex with different people, there is a high risk of contacting HPV from those people, which later develops into cervical cancer if it is not treated. 1,078 had between 1 to 4 number of sex partners, which is all right, while 155 had between 11 to 20 as well. So you see, we could say these people who are between 560 and 155 are at high risk of cervical cancer. Number of sex partners, high risk and low risk factors increases the risk of CC. Now let's study this. We already know that 115 had sex, started having sex between the age of 10 and 15, which is a high risk factor. 11.3 had first coitus at the age of 10 to 11 years. 60% practice poor diet. 68.7 involved in unprotected sex. 94.8 never received HPV vaccine. 43.3 with low income per month. That's lower than 100 USD, which is just 30,000 Nigerian currency, which is very low. It is even below the minimum wage, which is really not good. In terms of multiple sex partners, only 2.0 among 115 women are at high risk of formation of cervical cancer. Awareness. So we check their level of knowledge to know if they really know what HPV is and how they could prevent it. 1,626 women have no record of HPV 16 or 18. It means they have never gone to the hospital to even check themselves, so they don't have record. 60% of the population do not have adequate knowledge about HPV and CC. 1,141 have neither attended HPV-related seminar nor read about it. 75.2 do not know that HPV 16 or 18 are the leading cause of the 70% CC in the world. 91.6 do not know that there are other HPV genotypes apart from 16 and 18. 85.7 do not know that it takes 15 to 20 years for HPV 16 and 18 to develop into CC in women with normal immune system, while 77.8 do not know it takes 5 to 10 years in women with weak immune system. 96.6 have never been to the hospital to check if they are to check their HPV status, whether they are positive or negative. So based on their awareness, we can see that these people have no knowledge. Many have no knowledge about HPV, and therefore they are at risk. Also, 93.9 have never taken HPV vaccine in their lifetime. 96.5 have never heard about HPV-related births, because they are kind of when you are infected with HPV, around your private parts, you begin to feel some swollen. These swellings are called warts, HPV-related warts, like syphilis and all that. 83.8 do not know that early sex increases the risk of HPV infection. 82.4 do not know that persistent or untreated HPV can progress in the formation of CC in future. 70.4 have never attended a pap smear screening before. Now, if these women have never gone for this screening to check if they are infected with HPV, or if they started developing cervical cancer around their cervix area, how would they be treated early? So their level of knowledge is very poor based on our research. Association between risk factor and age at first coitus using the product moment correlation. So the Pearson correlation showed a negative linear correlation of R equals to 0.233 between the age when each woman had their first coitus and the age generated by the two. So what is this result saying? That the higher the risk score, the higher the higher their risk of contacting cervical cancer, which also means that these women, many among, though it is a negative correlation, which says that the age at first coitus was actually diminishing. That is, there was a lower as compared to their score, which is higher. So the age when they started having sex was very low compared to their score. So the lower the age, the higher the score. Yes. So the lower the age at first coitus, the higher the score, which makes the woman at risk or puts the woman at risk. Discussion and research proves that 38.6% of the women included in the study are living below the current Nigerian national minimum wage. True. And the minimum wage is 30,000 naira. And we said many earned below 100 USD, which is an equivalent of 30,000 naira. Women who had first coitus at early age had between greater than 11 to greater than or equal to 20 number of sex partners and practice poor diets are likely to develop, are at a high risk of CC, or are likely to be in the first stage of CC development. So these people, these women, they could be at the first stage of this of the development of CC, which could be treated, but they don't know. Descriptive statistics has revealed that over 60% among 1,638 women are well informed about the causes of HPV vaccines, and the fact that HPV 16 and 18 are the leading global cause of 70% in CC in women. Excuse me. The association between the scores obtained by the women and the age at first coitus shows that age at first coitus, having sex, that is, having sex at a younger age, between 10 to 15 years, accounted for a portion of 5.4% of the variability of each woman's total score. So what are we saying here? That these women who started sex at early stage between the age of 10 to 15 years, there is a 5.4% chance that it increases their risk, their total score, their risk score. So early sex has a 5.4% chance of increasing the risk of HPV infection. This study, in summary, we say this study has revealed that women residing in both rural and urban settlements in Nigeria are at high risk of the formation of CC, whether now or in future. Statistics shows that most women in Nigeria are not well informed about HPV and CC, which makes them vulnerable to high mortality rate of cervical cancer disease. The study also shows a high risk impact of early sex among women who had their first coitus between the age of 10 and 15 years. Early sex should be abolished by the government among the male and female teenagers in Nigeria. Parents should also pay close attention to their teenage words in order to prevent them from engaging in early sex. It will help. We are Africans, so we should be taught morals. Yes, sex education should include the risk of HPV infections, which include the risk of HPV, should be taught among both in high schools and tertiary institutions. HPV vaccine should be freely administered in both rural and urban settlements in Nigeria. Thank you for your attention, and I hope you have learned so much today. And I also hope that you will put to practice what you've learned. Thank you.